A diet plan can be a great tool when you're trying to lose weight, but there are a couple things you should consider and think about when you're using it to make sure that it does help you. And so I'm going to talk about 5 things that you need to look out for when you're using a diet plan for weight loss. The first one is that you want to make sure your diet plan is set for a realistic goal. Anytime you set a weight loss goal and use a tool to reach that goal that's too aggressive, it can lead to really excessive hunger to where you're distracted and you have mood swings, and it also can cause muscle loss if your goal is too aggressive. So a realistic goal for most people is attempting to lose about 5% of your body weight in 12 weeks time. That's a really good benchmark to aim for, and that's one we've seen that's very doable time and time again in countless scientific studies. The second thing that you want to look out for is that the diet plan can be adapted depending on your progress. So we can make a really good guess about what you need to lose body weight, and it's a best guess, but at the end of the day, it's just a guess, and everyone is different. And so if you're following a diet plan to the T and it's not producing weight loss, that probably means that the calorie level it was originally for is not appropriate for your weight loss. And so you definitely want to have a system in place where whatever diet plan system you're using, that diet plan can be adjusted and adapted as you learn more about your body and what it needs to lose body fat. The next thing that you want to make sure it has is that it includes strategies to help you with your day-to-day challenges. So a diet plan is exactly that. It's a plan, and sometimes things don't go according to plan. And so in that case, you want to make sure you have some support, whether it's someone that you can reach out to that's well trained to answer your questions about what to do, or maybe there's educational information and tools for those times that you just cannot stick to your diet plan. It's helpful if you know what to do in that case. And then, of course, it's also helpful if that diet plan considers your health and not just your weight loss. So some more generic diet plans, may or may not be appropriate for your health conditions. And so that's something you want to double check about the diet plan if you do have health conditions. Make sure it's okay for those. And then the 5th and final thing that you want to think about when you're using a diet plan for weight loss is it something that you can actually follow every day? Ideally, a diet plan is so personalized and customized that it almost feels like normal. Like it should feel very similar to how you always eat, but maybe with some more specific directions and quantities and specifications. If that diet plan is asking you to do something extremely different, then if it requires so much planning to execute that diet plan, chances are that it'll be hard for you to actually follow it day after day. And remember, when you're trying to lose weight, it's not something you need to just do for a few days. It's something you will need to do probably for a few weeks, maybe even a few months. So make sure it is something that you can sustain and that you can stick with. So let's just recap. The 5 things you want to look for is that first, it's planned for a realistic goal. Second, it can be adapted as you go and as you learn about what your body needs to lose weight. The third thing is that it should use a variety of strategies to help you with your day-to-day if things don't go according to plan. And fourth, it should consider your health conditions if you have any health conditions that diet can affect. And finally, 5th, you want to make sure that it is a diet plan that you can actually follow every day for a while. Good luck. Thanks for listening.